So if you've got a teishin, grab it. Got a close-up here of how to do a single-handed grip with a teishin. I mentioned before, pericardium channel is very important. This is the end of the pericardium channel. All right, so we got PC9 right here. Something else to pay attention to is the tail of the teishin is protruding past my finger. Very often people will line it up with their finger and it kind of gets stuck in kind of the fold of their pip joint here. We want to avoid doing that. Your finger's going to get in the way. It's going to add to the weight of the teishin and you're not going to be able to manipulate it very well. When I'm holding this, the tip of the teishin to be right at pericardium 9. And I want the tail of the teishin to protrude past. And then I should be able to kind of move it around, like it should be comfortable. Okay. Then I'm just going to add my thumb to it. Just bring my thumb down. And now it's supported and I can move my hand around without dropping the teishin. When we actually treat, you want to be a proper Englishman drinking your tea. The pinky should be up. So that's going to do two things. If my pinky's down, my hand gets heavy and I close Lao Gong. So Lao Gong gets closed off. When I do this, Lao Gong gets open. That space opens up and my hand lightens. Now I don't want to like shove it out here so it's like tense, but just lift the pinky a little. Make your hand light. When we're contacting the patient, we're going to be contacting the patient with our finger and the teishin. We're not doing this to the person. We're contacting with the finger and the teishin. So we're rooting onto the patient with our finger, and then the teishin is acting as a focal point. Right? So this is essentially the position. You'll notice my wrist is nice and straight. It's not bent down. It's not curled up. Wrist is nice and straight. Pinky is slightly extended. Lao Gong is open, allowing it to travel. PC9. Let's talk a minute about pericardium, because this is really important, and I'm going back into what we're doing with our bodies. Pericardium is the envoy to the emperor. We do not talk directly to the emperor. We use the envoy both to protect ourselves and to communicate with the patient. If we think about what pericardium 9 is used for in terms of these actions and indications that everybody loves so much, pericardium 9 is used when people have an inability to express themselves, when they're overly timid, when they're poor communicators. We use pericardium 9. If that's the way we treat people, as a practitioner, if we've cultivated our pericardium, if we are good at expressing ourselves and good at not being timid in treatment, we can use pericardium 9 as an expression of that. So the deficiency that we think of in terms of what we would treat with it, we can also use it as a practitioner. So let's look at the pericardium channel. It starts at the heart, obviously, wraps around the heart protector. What is this? This is CV17. It's the middle dantian, right? Now, the main channel that we all think of, that exterior channel, emerges and comes down the arm, inside of the arm. But there's an internal channel that descends from the pericardium down to the lower dantian. When we breathe, we are using our pericardium channel. Pericardium channel, in terms of sinew channels, covers the diaphragm and the ribs. So when we treat, if we close our armpits and we drop our arms against our side, we're closing all of that off. We're closing that expression off. If we're not descending our diaphragm and breathing down into our lower dantian, we're closing that aspect of things off. Now, there's also another channel, the divergent channel, that runs from the lower dantian up to the ear. That's not as important for this as the other aspects are, but just be aware of that. Keep your neck engaged. Keep the pericardium channel as open as possible when you're treating. It will both protect you because you're not going to speak from your heart. You're going to speak through the envoy, and it will help you to express yourself in an articulate way through the needle. So pericardium 9, very important.